Okay, good afternoon, ladies and gentlemen, and thank you for attending once again. And we are, as usual, doing an update on the COVID-19 situation here in the City of Hamilton, the activities and actions that we're taking to protect the community and the citizens in our community. I can say at the outset that I understand there are 4 new cases that Dr. Elizabeth will outline for you in a moment, and our manager, Paul Johnson, will outline some Emergency Operations Center recommendations that are, thank you, that are going to be forthcoming. And as we know, or as you know, these are difficult decisions that we're having to make here, but all aimed towards preventing spread in our community. And we've witnessed some recommendations coming from the federal government, from the provincial government, medical officers of health both, and the governments of the province, Prime Minister Trudeau and Premier Ford. So, we're reacting to those recommendations as well as the new cases that are confirmed here today. So I'm going to turn it over to our Director of the Emergency Operations Center, our Director of Emergency Services, Paul Johnson, to outline some of the new changes that we're advocating and recommending today. And then Dr. Elizabeth will give you an overview of the cases that we now have confirmed. Paul Johnson.
Thanks, Mr. Mayor. My apologies for the casual attire. It was shave and iron a shirt or get to the EOC early this morning, so I chose the latter. I do want to extend my gratitude to the folks who are continuing to work at our Emergency Operations Center. Yesterday I talked a little bit about the height of the activation that we're in. Today I do want to specifically mention the work that's happening in public health services. The amount of calls that are coming through our public health services are enormous, and I do know that there are a number of people working incredibly long hours to help ensure that we get back to people who are concerned about their own health. And I wanted to start today by talking about that, because at the end of the day, all of the actions that we're taking are about the health of our community. So at our last press conference, I did talk a little bit about the phased approach we are taking to shutting down a variety of programs and events. And yesterday was about ensuring that we are curtailing activities that naturally brought people together in our community. Today, we're extending that to announce the next phase of what will be full closures of some of our facilities in order to ensure that we continue to protect the public and also ensure that we have the resources as the City of Hamilton to deploy our staff where it makes sense. As you may imagine, some of the programs that we normally offer in the centers that we talked about yesterday, because there are no programs, there are no people. So many of these programs have been essentially closed since yesterday anyways. This morning, in consultation with our Medical Officer of Health, Dr. Elizabeth Richardson, and to help slow the rate of infection in our community, we've taken this next step and will be closing a number of municipal facilities beginning tomorrow. Those facilities include recreation centers, our senior centers, seniors clubs, the Ancaster Rotary Centre, arenas, community halls, the Gage Park Tropical Greenhouse, city-run museums, the Tourism Visitor Centre at the Lister Building, and all of our Hamilton Public Library branches. So all of those facilities and the list of those facilities are provided in the media release that we've issued and will also be on the City of Hamilton's website. I do want to note with that last announcement around the public libraries that I have been in contact throughout the day with Paul Takala from our library system, and so Paul was in complete agreement that he would work with the city and move with the city in concert with these closures. In terms of childcare, you will know that the City of Hamilton directly operates one childcare program, and that childcare program will close as of Tuesday. So the closures I've announced originally are as of tomorrow, but our childcare center will close as of Tuesday. On Monday, our childcare staff will be reaching out to families and working with them and communicating with them about the impending closure of our childcare center. The City of Hamilton operates a small number of childcare spaces throughout the city. Most of childcare is delivered by community organizations. Many of them are also closing for the next 3 weeks. I would encourage families with young children who are in childcare to contact their childcare provider to see what is happening in terms of their childcare beginning on Monday. During these closures of our facilities, the City of Hamilton is going to conduct some deep cleaning and disinfection activities at the facilities. As well, wherever possible, we're going to complete some minor maintenance activities and reallocate some resources to take care of some scheduled maintenance so that when we do reopen these facilities, we don't have to close them down later for this minor maintenance work. All of these announcements today follow the same time frame that I talked about yesterday. The tentative date for all of our programs and, of course, therefore the facilities to reopen would be Monday, April the 6th. We will, however, be continuing to monitor the situation, and should that date change, we will inform the public in the coming weeks. It's important to note that the list I read is not the sum total of facilities within the City of Hamilton. There are a number of facilities that will remain open and continue to remain open at this time. City Hall is an example of that. Our Ontario Works offices, municipal service centres, our Mountain Transit Centre, community recycling centres, the HSR service counter at the GO station. Our municipal cemeteries are open for services, although programs such as tours have been cancelled. The Hamilton Water Service counter at 330 Wentworth Street North is open. Our housing services counter at 350 King Street East, the First Place building, will also be open. Animal services, parking system service, the Provincial Offences Administration offices, and our municipal licensing and bylaw services offices also will remain open at this time. I do want to address the issue around long-term care. The city does operate 2 long-term care facilities, and of course we continue to provide the quality resident care in those facilities. The Ministry of Long-Term Care has announced that visitors are no longer to be allowed access to long-term care facilities, and our Macassa Lodge and Wentworth Lodge facilities are complying with that direction. We understand that this is extremely concerning for families of the residents who are at our long-term care facilities. This is a difficult time, and we feel for them. The important announcement around this is that visitors and family members cannot visit their relatives and their loved ones in our long-term care facilities, except in end-of-life situations. There are exceptions that are made in those final days, so it is a difficult time for those with loved ones in our long-term care facilities, for sure. All of our city administrative office buildings will also remain open. We have instituted enhanced cleaning and disinfecting procedures to be in place, which will protect our staff who are working in those facilities. We are encouraging residents in the City of Hamilton and business owners in the City of Hamilton to complete service transactions that they can online. If you can do that service online, that protects us a little bit from having large numbers of people come to our facilities. We'd also encourage you to look at doing work during off-peak hours or coming and doing some business over the phone. And I think it's important to note that if you do attend city facilities, you may experience delays. This could be as a result of some of the staff redeployment that's occurring across the city or for other reasons. There are a number of services that are not impacted, and it's important to recognize that things like our emergency responses, Hamilton Police, Hamilton Fire, Hamilton Paramedic, continue to operate as normal. Our transit service is unaffected. Our water operations continue. Garbage, recycling, and organics collection continues. We are working with our partners who address issues around homelessness and poverty in this community, and our emergency shelters, our residential care facilities, any drop-in centers that exist within the community are working with our staff around procedures to ensure that they can remain open and remain to provide the support they need to vulnerable persons in our community. Roads, sidewalk, bikeway operations and maintenance, including snow removal, knock on wood, that doesn't come our way, will continue as usual. We also want the community to know that the Hamilton Farmers Market continues to operate. As of today, the city also has revoked all special event advisory team, we call it SEAT for short, SEAT permits for all events until April 6th, 2020, that are over 250 persons. And we are going to work with organizers in those events over the coming days to look at different ways that they can operate those events, postponing them, moving them to alternative times for sure, or whether they're going to be fully canceled. We are working continually with our partners who deliver service on our behalf to provide advice to them also about whether they should be operating their services in the coming days and weeks. It did come up as a question yesterday. I can tell you that when it comes to council and committee meetings, the operation of our civic government, we're continuing to review how best to do that. Our next cycle of committee and council meetings doesn't happen until a week from now, and so we're continuing to look at that, work in consultation with the mayor and council, and further information will be provided about those upcoming meetings. I know a number of our employees watch these updates and continue to look to these press conferences for information. And I can tell our employees at the City of Hamilton that a detailed email and question and answer document has been sent to you. It does outline a number of things that are important for you as employees, including the announcements that we've made in previous days about how to work through this difficult time. If the facility that you work at as city staff or the program that you belong to has been listed in either yesterday's conversation or today's conversation as closed or canceled, you do not need to report to work unless otherwise notified by your direct supervisor. It's important to note that no employees will be laid off at this time and there's no loss of income. And we're working with our people leaders to ensure that our staff understand where they're going to be going on Monday. I would ask that the public and our staff, quite frankly, recognize that things are moving. We've had to make this announcement today on the weekend. We're getting information out to our staff and our community over the course of the weekend. And so patience is appreciated from the community, particularly those who may arrive at facilities tomorrow, find them closed when they thought they might be open. But this is steps we felt were necessary to take and necessary to announce today. So in summary, the majority of city facilities that offer programs to the public will be closed as of this evening and will remain that way until the first time that they could reopen would be April 6th, about 3 weeks from now. I do want to remind folks that there are plenty of ways to keep up to date with information online. We continue to do these types of updates, but the best advice is to send information to or send your requests or look up your requests at our website. But if there are questions about service delivery and program impacts, I would encourage residents and others in our city to call 546-CITY. Our customer contact center has information about all of these closures, and they will also be able to direct you to the appropriate staff members if we've missed something or there's something that's not clear in the announcements that we've made today. So 546-CITY is a way that you can communicate by phone with our customer contact center, online, and of course there is a tremendous amount of work being done through the Public Health Service hotline and website and email address as well. That's the information in terms of our emergency operations centers. Obviously, we are in close contact with what's happening with public health, and as the mayor mentioned off the outset, and we've been informed in the emergency operations center, there are additional cases in Hamilton, and I'm going to ask Dr. Elizabeth Richardson now to provide an update on that.
Thank you very much, Paul. Thank you very much, Mr. Mayor. So Hamilton Public Health Services has received notification of an additional 4 confirmed cases of COVID-19 in our community. Early indications are, as we're investigating these cases, is that they are travel related. However, we're still underway in terms of our investigation and getting more details on these cases. In terms of risk, again, to reaffirm it's unlikely that anybody in Hamilton is going to be exposed or infected to COVID-19. But we are encouraging everybody to continue to follow public health measures. Residents do need to be mindful that the situation is evolving rapidly and to keep in touch with updates on a daily basis in terms of what is happening. A reminder about how you can protect yourselves. These are the most important measures you can follow. So stay home if you are ill. Please do not go out and contact others. Certainly, there are social distancing measures, as we've talked about, so things like bumping elbows instead of shaking hands, those sorts of things. What we're trying to do is break those pathways that COVID-19 can be transmitted by. Avoiding crowded places and non-essential gatherings is another thing that people can do from a social distancing perspective. Wash your hands often with soap and water, or use hand sanitizer if you don't have soap and water available. Avoid touching your eyes, mouth, and nose. Avoid contact with people who are ill. If you do see people who are ill in the community, avoid contact with them and their items. Remember to cover your cough or your sneeze with a tissue, or if you don't have that available, to cough into your sleeve or sneeze into your sleeve. Remember, too, to wash your hands even if you do those measures after that has happened. Of course, maintaining a healthy lifestyle, making sure that we all get our exercise, making sure we get our sleep, those are all important to maintain our body's immune system along with a healthy diet. Again, around large events and mass gatherings, the recommendation is that any event with over 250 people planning to attend, that those be canceled or postponed. For smaller gatherings, you can contact Public Health Services at our hotline and get some guidance. Things to think about, though, are about who is coming to those sessions. So sessions that are for people who are elderly are not recommended. Venues where people are going to be tightly crowded together, those are generally not recommended. Again, avoiding that crowding and maintaining social distance. And again, a reminder around travel, we recommend avoiding all travel outside of Canada, particularly with regard to cruise ships. And if people do return from outside Canada, it's being recommended that they self-isolate for 14 days. If you do choose to travel as well, if you need to for essential purposes, keep in mind that you might run into a healthcare system that doesn't quite operate the same way that ours does. There is a possibility that you may end up locked down within a country, or that there may not be travel arrangements to return. So you might be away much longer than intended. So that's it from me. Back to you, Paul. Mr. Bear.
So once again, an awful lot of people are working extremely hard to make these decisions. The Emergency Operations Center, the call center, is working full-time to deal with your calls, and we appreciate all of their effort. And I know the EOC will continue to operate as long as necessary to make decisions as we go forward. I would ask everyone to be patient. We understand the challenges and difficulties that this is going to cause in our community. Yes, for the elderly, for families with children that are expecting a March break and now have limited things to do. This is particularly difficult, but unfortunately very necessary to stop the spread of this virus in our community. So we thank you for your patience, and we encourage you to make wise decisions. Lots of information is available on the website that I think is identified on the screen here, and the hotline as well. You can call anytime and get some additional advice as to what good suggestions and good recommendations they can give you to make proper decisions as you go forward. And we will continue to provide updates as necessary as things evolve in our community. And on that note, we'll ask any of the media here that if they have any questions.
I guess we would like a few more details about the 4 cases, if possible. What the circumstances were, how old the people are, perhaps.
So we're just getting underway with those investigations, and so one of them is a child who's about 3 months old. There are a couple who are in their 60s, and there's a third case I don't have a specific. The fourth case I don't have a specific age for. In terms of where they have been, we know that the couple is associated with a cruise in the Caribbean. The other travel details I don't have at this point.
Do you know where they live? Are they living in single-family residences, or are they in like something where like a nursing home or a place like that?
As I understand it, all of these are living in their own homes. I don't know the type of home.
Are any of them in hospital right now, or are they all at home?
No, all of these are at home. None of them are hospitalized.
Sorry. Is there an investigation going into if those people were potentially in public areas where others might have been exposed?
So with all of our investigations, we go through an exhaustive list of contact tracing to determine those things, and that's what's underway right now.
Is there a timeline for when we might get some details about that?
In terms of those, if there was something exceptional about that, then we would put forward those details, but in general, we don't give details on the contact management.
Can I ask the 3-month-old child, would the parents also be under suspicion of perhaps having the disease if a 3-month-old child would have it?
So those are all the circumstances that we're looking at right now.
All right, thank you, everyone.
Oh,
and we'll,
sorry,
good?
we do have more questions for sure.
Oh, okay.
If you could just spare a few more
Bring it
minutes.
on.
The situation with people returning from travel elsewhere and having to self-isolate for 14 days, I would think that could have an effect on city staffing levels and also hospital staffing levels. Is that something you're able to address?
So certainly from the city's perspective, able to address that. One of the reasons that we've been working over the weekend, and one of the reasons, quite frankly, we've been looking at some of these facility closures, is to ensure that we have staff that can be redeployed. We've already had to do that to deal with the surge in public health. But yes, we do know that people have traveled. We do know that people are traveling. And so this could impact us from that standpoint. We also know now that there's going to be a significant impact with the amount of closures that are happening, particularly with childcare centers. So there will also be a number of our staff that are impacted by the decision of childcare centers not to provide that care. So we will have a number of challenges. I would say the travel is one element of it, but some of the childcare issues that are there because of these shutdowns are also a consideration for us.
The last I heard, it was 57 extra public health staff that had been redeployed. Is that number now more significant?
That number has gone up further. As of today, we're well over 120 staff that are redeployed.
Right. I was wondering if you could speak a little bit, anyone who can, about this has been a tough budget year for public health. There have been provincial cuts. I can't remember how many millions of dollars the gap is. Are you able to speak to a couple of things, the importance of public health services, how this shows just how important public health services are in a situation where there is a pandemic? And the second piece is, where are we with our budget year in terms of what funding we can expect from the province? Do you have to juggle any more of the books depending on what is not being cut? I know this has been a juggling act in the past, and is this changed even more?
I would think those are decisions for the future. So our staff are going to be quantifying the costs that they're going to bear going forward. We're hopefully going to finalize our budget when we meet, early in after March break. I have no reason to believe that there's any significant change at this point. Whatever additional cost that has to be borne, we do have reserves, and we would likely dip into reserves to make sure that those costs are being taken care of. And then we will quantify and ensure that the province is aware of the additional costs that we've had to bear. So I'm not, the province is committed to no additional cuts. They've also committed to, I believe, $100 million provincially and $1 billion federally. I anticipate that some of that may come to municipalities, but will also go to businesses to offset people's lost wages and other things that will occur into the future.
You don't have a sense of how much Hamilton could get out of this additional funding that's been announced yet?
How much? No, we don't know at this point. No, I think it's too early to tell that issue. I think that's still evolving, and I think we'll measure that as that goes forward, and then whatever application process they have for that, we'll certainly be aware of and we'll tap into.
Okay. I just wanted to ask, Paul, you mentioned, I think there's a meeting coming up on Tuesday with shelter providers and other social service agencies. The one question that I was wondering about, well, there are many questions, but one thing is, what do you do with a person who needs to self-isolate and they're homeless and they're staying in a shelter?
I'm actually going to let Elizabeth answer what protocols might be in place for that.
Thanks very much. There are some protocols already in place to deal with infectious diseases like tuberculosis and that sort of thing. So we can apply those ones up front. And then we're looking at what might happen if there's spread or further concern beyond that in terms of contacts. So we're getting some information out to all of the shelters today, residential care facilities, retirement homes, some reminders too for the long-term care homes, in addition to what they're receiving from the province. And then we're going to be working on specifically how to manage those. We do know the Shelter Health Network is able to assist with assessment and testing and those sorts of things, which is great to have them there. So that we don't need to move people to other places, but they can get assessed easily by groups that's used to working with them.
Can I ask why we don't have information, like no information at all on the one case, like not either whether it's a man or a woman, or like why there's No information at all?
It's just a matter of time and us sequencing and doing our work, and I'm getting you the information I have up to literally the minute I have it, and I just don't have that yet today.
Have assessment centers been approved yet?
So the assessment centers are being approved across the province. I can tell you that they have been approved here, and we're looking at getting them up and running next week, but we'll have specific announcements about that coming up. We anticipate for Monday.
For families who may have paid for March break programming, maybe I missed this in the beginning, but are they going to be getting a refund?
Yes, so our commitment is that anybody that's out as a result of these closures, including we did have some groups that were using our facilities for the weekend and they've used them today, they won't be able to use them tomorrow. We'll be refunding all of that. A little patience is expected. It won't be priority number one on Monday to refund that, but all of the families, all of our user groups, if they're out of ice time for whatever it is, we'll be refunding that. So those are the things that we're working through administratively, and you know, it's been great. I do want to say that, quite frankly, the partners we've worked with, and one of the reasons that we took a phased approach yesterday and today was to work with partners. We do not deliver all of the programs within our facilities. We don't even manage all of the programs in our facilities. For instance, the Quad Pad Arena up near where I live on the East Mountain. So we're working with those partners, and all of them said, look, we're doing this together. And the public libraries is a great example of that. And they said, look, we want to talk, we want to understand the best information, and we're going to work together so that we make decisions that aren't confusing to Hamiltonians and that make the most sense at the right time. So yes, no one will be out as a result of this. We'll just have to figure out how all of that happens in the coming weeks.
Can I ask, why is the farmers market staying open?
So at this stage, you know, the Hamilton Farmers Market is essentially a retail outlet, and so we'll be continuing to work with the farmers market about how they want to plan to operate. But at this time, it was felt it was acceptable to keep that place open. We will continue to work with the board. We will continue to work with those stall holders and understand that they will be having to comply with our advice and guidance around that. So for instance, if one of the stall owners was to have traveled and be traveling back, they would not be able to open their stall. They would have to self-isolate for that same period of time. So some of those pieces of information will go out to those folks, but at this time it remains open.
Can I just ask, when it comes to the childcare centers, I know you yourself only have like a small number of spaces, but with the schools closing, like we're talking about hundreds and hundreds of childcare spaces. Is there any help for, you know, families, especially where the workers have jobs where they wouldn't get paid if they didn't go to work, or where they can't take time off, or like, is there anything to help these people out?
So there are limited options because we're talking thousands of spaces. And as of today, my understanding is about 75% of the childcare spaces in Hamilton, their operators have indicated that they will be closed for the same period of time through to through to April 5th, 2020. So there are limited options. We know the stress and strain this is placing on parents. But the reality is that all of these programs are taking a similar approach. So it's not just programs in school. Now the community-based childcare centers are also choosing to close for this period.
Sorry, is there something called a community benefits program that through OW that somehow, is there any funding there to help people out who are maybe short?
So there are a number of low-income supports that are available for a variety of issues. Some are available to individuals on Ontario Works. Some are available to all low-income residents in Hamilton. So those continue to be available. What they can cover, and of course our ability to cover some of this is what's going to be a case. They're not designed to cover lost wages. So those programs may be there though from a rent support perspective and utility support perspective. So we've been working in conjunction with the Hamilton Help Center for a number of years to deliver some of those programs. So there are some supports available. I would encourage people that if they are in difficulty, Again, 546 city, they will be connected in with the program area. I can't guarantee that there's a program that will help provide all the support they need, but what we can do is take people through some of the benefits and some of the supports that are available in Hamilton or may be available through the provincial or federal government that people may not be aware of because they haven't, up until this situation, needed to receive that kind of support. So it's impossible to go through every eventuality, but it is important that people reach out, ask for support, and through our series of nonprofit organizations and also through the city itself, we can at least offer some advice and direction and guidance.
I should ask, sorry, we're at level 2 is the activation of the
Yes.
operations center. What is the next level, and when might that happen, and what would it involve?
That is a good question. We are at the highest level. So we have 2 levels of activation. So we put it out and expect that everybody's been trained fully on IMS and our EOC system. There's a level 1 activation, which was our initial. It's a smaller group of people. The level 2 activation fills all the seats in our emergency operations center, and that's close to 40 people at peak performance. I will say that there are a number of other people that work through the system to make things happen operationally, but we've got about 40 people at peak staffing that are in the emergency operations center, acting as our liaison and ensuring that things happen on the ground. And an example of that, is obviously we've had to disseminate how can we make sure that we close these facilities in an orderly fashion and ensure that we communicate with staff. And so all of our operational leads across all departments have been working to provide information to their people leaders so we can get information out to staff. It allows us to do things like this on a weekend and ensure that it's done in an orderly fashion.
So we're not certain, did I understand it correct? We're not certain if there is community spread right now because we're in the early stages of the investigation of these 4 cases. Is that correct?
So in terms of community spread, that's always something we're looking at as part of the investigations, is trying to determine, is that a possibility? And so we're looking for that. At this point, we don't see that, but that is something that we're looking for.
If there is community spread, what is the next step?
So essentially what we're doing is trying to maintain containment. And so the steps that you're seeing us take in terms of the social distancing, what's happening with schools, what's happening with daycares, what's happening with city facilities, is all in an attempt to reduce the likelihood of transmission. The steps that we're asking individuals to take, the avoiding crowds, staying away from people who are ill, staying home if you're ill, sneezing into your sleeve, all of those sorts of things are meant to reduce the likelihood of community transmission, as are the steps that we're taking. So we're already working on all of those things in an effort to prevent that.
Okay, we encourage people to continue to be patient and vigilant, look after one another, certainly help the most vulnerable in our community, the seniors and those marginalized individuals out there that are probably most challenged by all of this, and we will continue to update as required when changes occur. Thank you all.